Hi, my name is Maria Colway with MP Systems. I'm a safety specialist and a licensed athletic trainer. I have a lot of employees come to me with elbow discomfort, so today I want to talk to you a little bit about the anatomy of the elbow, what may be causing the pain, and what we can do about the pain to prevent that from coming back to you in the future. Elbow and forearm discomfort is not new for the utility worker. Whether you are noticing a general soreness, a mild ache, deep lingering discomfort, or debilitating elbow pain, it is important for you to understand forearm anatomy, common causes of the discomfort, ways to combat the discomfort, and ideally, ways to prevent it from ever starting in the first place. Diving right into the forearm anatomy, there are a few main things to point out. First, let's look at the lateral epicondyle of the humerus. That is the bony protuberance on the outside of your elbow. Then let's look at the wrist extensor muscle grouping on the top of the forearm. It is important to understand that these muscles attach to the elbow at that lateral epicondyle. If you follow the wrist extensor muscle grouping down toward the hand, you can see the muscles turn into long tendons that attach to each of the fingers. Similarly, on the underside of the forearm, you have the wrist flexor muscle grouping that attaches to the medial epicondyle on the inside of your elbow. And then again, those muscles run all the way down to your fingers. Keep in mind where these forearm muscles attach at the elbow and down to the fingers, so you can see why the elbow is connected to any activity that involves gripping, extending or flexing the wrist, or supinating or pronating the forearm, which is the motion the forearm makes when it turns a doorknob. These motions work the forearm muscle groups, which in turn can cause certain stresses to the elbow where those muscles attach. The body can handle these motions fine in normal circumstances, but when you add these motions with excessive forces, repetition, awkward postures, or hold these positions for a prolonged period, the tissues and the bony attachment area can become irritated and will signal a pain response to your brain. Looking at some examples of everyday tasks, you can see how gripping activity involves the elbow. Pay attention to the forearm muscles as this employs reaming conduit. You can see the wrist extensor muscle grouping contracting near where the muscles attach to the bone. Now think about the daily tasks that you do, both at work and at home. Nearly every activity we do involves these muscles to some extent. It is important to try to get your body in the best possible position, which is with the elbow bent near 90 degrees and with the wrist in neutral. Think handshake position. This minimizes stress to these muscles, tendons, and their attachments. If you are participating in activities that overexert these muscles, puts your wrist or elbow in awkward positions, or involves repetition or static holds, you should try to take micro breaks to get out of that position. These breaks can be just a few seconds up to a few minutes. This will allow the muscles to relax and return to their normal state, allow proper blood flow, or let them stretch out. If you are experiencing discomfort, it is important to address it early. Discomfort or pain is your body's way of letting you know it needs something, so don't ignore it. Some of the self-care techniques include massage. One massage technique includes taking the outside of your opposite hand, placing light to moderate pressure at the top of the muscle, and pressing down away toward your hand. Avoid any bony prominence, just stick with the muscle area. Another technique is a trigger release technique, which involves finding a tight area in the forearm, placing direct pressure on it, and then bending your wrist up and down, side to side, or turning it back and forth. Do this at multiple spots throughout that whole muscle area. Performing forearm stretches is also very important to maintain flexibility and allow the muscles to stretch back out after activity. The wrist flexion and extension stretches should be performed with the elbow straight and then using the other hand to pull the hand either up or down. You can try these same stretches with the elbow bent as well. You may just notice a stretch more so in the wrist area. Exercises may help condition the muscles by improving their strength or endurance. An easy and effective one is to grab a rubber band, such as the rubber band that is around broccoli or asparagus. Place the rubber band around all fingers and your thumb, then spread them against the resistance of the rubber band. Just make sure to keep a neutral wrist when you are doing this exercise. Another great forearm strengthening is the 4-way wrist exercise. Grab a 1 to 3 pound weight, or even a bottle of water, canned good, or the like. Rest your forearm on your elbow, starting with the palm facing down. Bend your wrist all the way down and then all the way back up. Second, flip your forearm over so the palm is facing up. Then bend the wrist all the way back and up. Lastly, move the weight to one side of the hand. Then rotate the forearm up and down. Understanding the physiology and body mechanics behind the elbow is important in this industry where it is easy to tax these forearm muscles. Do what you can now to prevent discomfort so you can continue to enjoy doing the things that you do, both at work and outside of work.